All right, this is my semester project, part two. My name is Blanca Hernandez. And this first slide is introduction and background. I chose child welfare. It's important area of social work that focus on protecting children from abuse and neglect. Many children in foster care have experienced difficult and traumatic situations, such as violence, neglect, or being separate from their families. This experience can have a lasting impact on their mental health and development. In this presentation, we will look at the challenges these children face, the effect of trauma, and the way social work can help support their healing and well being, as well as the outcome of the interview I did. Okay, in this slide, uh, I'm going to explain how trauma affects children and why resilience is important. Mm, we are focusing on children in foster care. Many of them have experienced situations like abuse, neglect, or being separate from their parents, which can be very difficult for them because of this, they often develop emotional problems like depression. They may also have difficulty with behavior or learning in school, and some children can even show symptoms of PTSD. This is why it is very important to support these children and help them develop resilience so they can have better well-being in the future. Okay, now I'm going to talk about how can we help these children. One important way is trauma focused cognitive behavioral therapy or TFCBT. This type of therapy helps children understand what they went through and how it affects them, and also teach them how to manage their emotion and cope with difficult situation. In addition, it helps them feel more comfortable talking about their experience. Caregivers are also involved, which is very important for the healing process. Uh, as a result, children can have less anxiety and depression and fewer trauma symptoms. They can also develop better emotional health and adjust more easily to daily life. Mm, okay, the next slide. Oh my god. Okay, this slide is my question interview, and um the interview is Elizabeth Dawson. Her position is Senior Social Worker in the Division of Child and Family Services of Utah, and she is responsible for working with foster families and children. Okay, first, she explained that young children often show trauma through their behavior, not with words. For example, They may cry a lot, have a sleep problem, or act aggressively. She also mentioned that experience like abuse or separation can affect a children's trust, self-esteem, and emotional development. Many children develop depression and may have difficult connecting with others. To support these children, she highlights the importance of having at least one stable and caring adult, as well as access to therapy and safe environment. She say that one of the most effective treatment in trauma focused cognitive behavior therapy. This helps children understand their emotion and express themselves in a healthy way. Okay, children in foster care need faster access to mental health services, a stable placement, and trauma informed caregivers. Different type of abuse impact children in unique ways, affecting behavior, emotion, and development. Building trust is a major challenge, as trauma often appears as behavior issues. The effect of trauma also vary by age. So support be tailored to each children's development stage. Okay, the next slide. Okay, sorry, I have a little problem with this thing. Okay, okay, this is a description of the agency with the person I interview work. Okay, she worked in the Division of Child and Family Services in Utah State. This is agency who to responsibility for protection children from abuse and neglect, managing foster care and adopting services, and supporting families in crisis. They work with children, parents, foster families, and community partners to ensure child safety and well-being. Okay, the mission of this agency is to protect children from abuse and neglect, promote safe and stable families, and support children in foster care and adoption programs. Her clients is children and young at risk, foster children, families needing support, and adopted families. Many have experienced trauma, neglect, or abuse. Okay, this slide talk about the salary. Uh, Social workers at DCFS typically start around 45 to 50,000 per year, depending education and experience. Where can we find info in Utah State, job postings, and Glassdoor or Indeed? So we can have some opportunities for jobs, and we can access for senior social workers, supervisor or team lead, also program manager and administrative or police roles. All right, that conclusion and this assignment, uh, okay, is that trauma affect children in different ways, depending on their age. Young children often show problems through their behavior. School age children may have difficult in school in social relationships. Teenagers may hide their feeling and experience depression or risk behavior. It's so important to give support based on the child age and development needs.